light.
Thank you, Mr Speaker. Mr Speaker, today I'd just like to briefly speak about Men's Health Week, which is next week, from the 14th to 20th of June. Men's Health Week is an opportunity for the community to focus on the health and wellbeing of men and boys in our community and what we need to do to improve the health outcomes for them. Mr Speaker, just some data. In the latest edition of the Australian Institute of Health and Welfare, dated 2018, the following figures are provided. Half of the Australian population, or 49% of, or 12.4 million people, are male. On average, Australian males experience different health outcomes to Australian females. And I'm just quoting from the report. They are more likely than females to engage in risky health behaviours and to die prematurely. They're also more likely to be homeless or in custody. Compared with females, males experience more of their total disease burden due to dying early from diseases and injury from living with disease. Mr Speaker, the importance of that fact is that when men get sick, they tend to die, more so than women. Women tend to be able to manage their illnesses, etc., and live longer. So in the case of men, it is quite fatal when they get ill. And it was interesting to read in the paper yesterday that men seem to delay reporting any heart attacks. And that's a topic sensitive to my heart, you might say, Mr Speaker, and that men are, for some reason, delaying reporting or seeing a doctor when they actually have a heart attack. Not sure why, and there's a whole thing. But what my message today is that if you're not feeling well, see a medical practitioner or a health practitioner, because it's very important for your health. And in case of heart attacks, I've now learned from experience that the quicker you get medical help, the quicker you get fixed up, the less danger of any long-term effect to your heart walls, etc. So I'm abiding by my health rehabilitation program at the moment, but men need to do that. Mr Speaker, on some other details, men, interestingly though, men do actually undertake more physical activity when women do. They actually, when it comes to diet, their diet is poorer than women's diet, particularly when it comes to fruit and vegetables and sugar. Men have poorer diets than women. Men are sadly more overweight and obese than women. And in fact, 75% of men are either overweight or obese. Men smoke more, drink more alcohol, and use more illicit drugs. And they're some of the high risk factors into poor health. When it comes to work, 9 in 10 people who are killed at work are men. And so either men are doing more dangerous work or men are not looking after themselves at work. Mr Speaker, when it comes to violence, 2 in 5 men have experienced violence since the age of 15. So over 40% of men have been on the receiving side of violence since the age of 15. 41% of that is physical violence, 4.7% is sexual violence, and 6.1% of men have experienced cohabitating partner violence since the age of 15. So these are often data which we don't talk about. These are things which we often don't talk about in the community, and as a result, we actually don't have a policy response. Mr Speaker, 1 woman is killed by her partner every 9 days, and 1 male is killed by their partner in every 21 days. 1/3 of women and 1/5 of men with disability experience emotional abuse from a partner, Mr Speaker. Mr Speaker, while those stats portray a very sad picture of men's health in this country, on a good side, on a positive note, there are some people who are doing some research to make sure we actually get changes in practice and policy. I'd like to mention the Freemasons Centre for Male Health and Wellbeing, which brings together researchers and stakeholder organisations across South Australia and Northern Territory. It's Northern Territory and South Australian divisions based at the Menzies School of Health and SAMRI, respectively. The mission of the centre is to improve the health and wellbeing of all males and consequently their families and communities while upholding the principles of equity, respect and integrity. Mr Speaker, since 2012, when Professor Gary Whithurt was appointed Director and Mark McGee, Executive Officer, and Dr Roger Sexton's Principal Patron, the Centre has actually a really good track record in research to improve the quality of health in this state.
The member for Flinders.
Thank you, Sir.